You are listening to the Knotted Physio podcast. I'm your host, Jenny Resmondo, owner of South Alabama Physiotherapy and creator of the Knotted Physio, where life should be fun and light. This is the podcast where we talk about how to keep the active adult who's busy with work and family life fit and healthy to enjoy the Gulf Coast outdoors. Let's get into today's episode. Before we start today, I wanted to let you know about our free Facebook group, The Knotted Physio. I do live trainings in the group each week to dive deeper into strategies to remain active and where you can ask me questions personally and I'll give you feedback. Okay, on to the episode. Hello, everybody. This is Jenny Resmondo, the Knotted Physio. Thank you so much for tuning into our podcast today. Today, I have a special guest with me. Her name is Jennifer Spencer. She is out of Hoover, Alabama, and is a pelvic health specialist. Welcome to the show, Jennifer.
Thanks for having me.
I'd love for you to be able to tell me a little bit about your background and why people need to know who you are.
So I am a physical therapist. I've been a PT for almost 14 years. I have a background in orthopedics like you do, but I have been led to get into pelvic health therapy or pelvic floor physical therapy. So I have my own practice here in Birmingham called Magic City Physical Therapy, where we treat predominantly pelvic health. We also see some lymphedema and breast cancer patients, but we love treating one-on-one, seeing patients for 60 minutes, really getting to know the patients and helping with a lot of pelvic floor dysfunction, which is often not talked about in the Deep South, especially here in Alabama, but I'm trying to help bring it more to light and becoming more of a talked about condition so that we can ultimately help these women and men.
Right. Yeah. Like you said, here in the Deep South, it's kind of a no-go whenever somebody is talking about bladder or bowel issues. So it's very important for us to actually be open and to be able to share whatever difficulties we're having, because there's actually solutions out there that work.
Correct. And conservative solutions, not just running out and getting a prescription medication for it or having a surgery, but there is physical therapy for it, and most people are shocked at oftentimes the quick results we have just by changing a few things, posture wise, breath wise, lifestyle wise, that are truly contributing to these unwanted bladder and bowel symptoms.
Right. So if somebody were to come see you, what would be the number one problem that they're having, say, with their bladder? What areas would they be looking for to go, oh, I need to go see her?
So we see a lot of pre and postpartum women. I'm trying to let it be known that any leakage is not normal for anybody at any age of life. So there's kind of a postpartum movement. A lot of pregnant women, OBGYNs are becoming more aware of the benefits of pelvic floor rehab. So we see a lot of postpartum women who are trying to heal from either vaginal delivery or cesarean section, trying to decrease leakage. And that could be, there's two types of leakage. There is stress urinary leakage, which would be more when you are sneezing, coughing, or running, jumping, things like that. And then there's more urge leakage, urge incontinence. And that would be more, when you get the strong urge to go and you just can't hold it and you just start leaking then. So both the urge incontinence involves more slow twitch muscle fibers, and then the stress incontinence involves more fast twitch, but we want to work both. So we see women with leakage, but not just postpartum. We see 70, 80-year-old women who just say, I don't want to be that woman who's having to buy Depends and wear them all the time. So we see older women who, had their babies 30, 40, 50 years ago that are just wanting to improve their pelvic health. So bladder leakage, we see a lot of people with constipation. That is something that we can greatly help as well. Um, any questions on that?
Well, I was just gonna say, so so far, you've talked about the ladies. What about the men who are out there? Are you seeing them as well for the bladder leakage and the constipation?
Yes, we see men as well. A lot of men will have bladder problems with chronic prostatitis, prostate cancer, prostatectomy. So seeing somebody like me, if you're having any prostate issues, can be of great benefit.
I'm gonna stop you
A
and ask you a
lot.
question.
Okay, go ahead.
All right. So there's a lot of men that don't really know what to look for when they have prostate issues. Like, what can you give some examples? Like, what would be happening that they would notice and that they could relate it to, oh, that's my prostate giving me some issues?
Well, it could start with bladder symptoms. It could
Okay.
be when you go to urinate that there's hesitancy and kind of an inability to eliminate the bladder. There could be pain in the prostate area or just pain with urination. So really any abnormal pain in the lower abdominal pelvic cavity, difficulty urinating, inability to urinate, frequency getting up at night. That's a big symptom, waking up multiple times at night to urinate. So if you're having any issues like that, I would definitely see a urologist and get the prostate checked out. And then, if you have to undergo treatment for that, ask for a referral for pelvic health therapy because there is research that we can help decrease if you do have to go through treatment, the symptoms afterwards. Like with anything else, the stronger, the more functional you are prior to, the better outcomes you have afterwards. So we can help people before and after any treatment for prostate issues. And there's a diagnosis that men often receive called chronic prostatitis.
Okay.
And it's kind of just a catch-all term for pain in the pelvic region. And so we see a lot of that. And they'll diagnose with prostatitis, but there's really no infection in the prostate. And so we see a lot of men with that. And usually it's more pelvic floor dysfunction causing those issues versus an inflamed prostate.
Yeah, so being a pelvic health specialist doesn't mean that you have to be a pregnant female or somebody who just had their baby. It could be the male, the person who's having difficulties, like you said, with pain in the pelvis.
And we consult with parents with children. Children can have pelvic floor dysfunction. Um, a child, a healthy child should not be having to wear diapers past the age of 5. And so if there's a child that's having problems wetting the bed, that's often a sign of pelvic floor issues. So we even treat kids with issues.
Okay.
Kids can be constipated and it can lead to a whole gamut of issues. So we treat all ages, anybody with a pelvis. So
So why should we
pelvic.
be concerned with constipation? That you've been talking about that a little bit, but what's the big deal with that?
So if you're constipated, you don't feel good. You feel backed up. You feel bloated.
Mhm.
Um, it can. So when you're constipated, you got all that in your belly, your bladder's not going to have room to fill up. So chronic constipation can actually lead to bladder problems
Oh,
and increased frequency of urination, leakage. It can cause tension in the pelvic floor muscles, which can contribute to pain, can contribute to back pain. Everything's related in kind of the pelvic and abdominal cavity. So,
okay.
um, mhm.
Well, so just so people are a little bit aware of dealing with coming to see somebody like you, a pelvic health specialist, is this invasive? Is there, are they going to have to disrobe to come see you? Because I know a lot of people are very private when they're talking about this area, especially here in the South. You know, everybody's
Correct.
conservative. So can you speak to that a little bit?
So our treatment rooms are private. This is not like going to a typical PT open gym clinic. So you are in a private treatment space with your therapist. And a lot of it, first visit is just talking and figuring things out, but we will establish what you're comfortable with. But if we need to, yes, we do internal work. um you are draped, so I mean you're not wide open, but again you're in a private treatment room, but it's, I equate it for women just like going to the OBGYN. Men, maybe if you're going to a colorectal specialist or a urologist, same type thing. But yes, we do internal exams. We are highly trained in internal exams. But if you want to hold on that, or avoid that, we respect that, and we can still work and do things externally.
Awesome. So a lot of my listeners are people who are in the outdoors. They're out on the boat, they're fishing, maybe they're kayaking or they're hiking, something along those lines. What would they need to consider, or are there any things to take into consideration when you're dealing with pelvic health and those type of activities?
So one of the biggest problems I see in not just outdoor enthusiasts, but just the general population is that we are not hydrated, and dehydration can greatly affect the bladder. A lot of people are drinking coffee, sodas, bubbly waters, essentially all day long.
Mhm.
And all of those things irritate the bladder. Most of us, that ideally, we all should be aiming for half our body weight in fluid ounces of mostly plain water. And when people start doing that, it surprisingly decreases a lot of abnormal bladder symptoms.
Mhm.
So if you're outside, and especially down at the Gulf, at the beach, where it's a little bit more warmer, you're sweating more, you actually need to drink a little bit more than that 50% of your body weight. So staying hydrated is a big way to stay on top of your pelvic health. If you think about it, so if you're drinking coffee, soda, not enough water, your urine is going to be more concentrated or more potent.
Mhm.
And that concentration of urine will actually irritate the lining of the bladder and make you go more often or feel more urges more often or even leak. So, if you can dilute your urine with plain water, your bladder will actually be able to fill to capacity and you won't have to go as much. So I would say for all you fishermen, kayakers, outdoor enthusiasts, drink more water.
That's the ultimate. Drink more water. So I'm gonna
But also it helps with constipation. Drinking water helps make sure you're flushing everything through the system. So.
yeah. Well, can you speak to the females in this and that are listening that are going out on the boats, maybe with their husbands, and maybe they don't want to go to the bathroom on the boat because it's not convenient or there's other boats around. What would you say to that person to be able to help them get over that stigma, if you will, of being the female on a boat?
Um, I mean, when you gotta go, you gotta go.
Right. So don't
So
So basically, hydrate no matter what. Don't sit there and dehydrate yourself so you don't have to go to the
correct.
bathroom.
Correct. Yes. Because dehydration can wreak havoc on your system. But yes, just jump in the water, go get it all out. Uh, but yes, also just speaking to the ladies, something I think a lot of women do is they go just in case. And
Ah,
that that's training the bladder in bad habits. So if you go, say you're about to go on the boat and you're like, oh, let me go pee one more time, get it all out. Well, if you are urinating and your bladder's only a quarter of the way full or half the way full, you're eventually going to train the bladder that that's when it needs to go all the time. So we need to all stop with the peeing just in case, before we go leave to go on the boat or go to the store or leave work, because that creates bad habits.
awesome. Well, if people are wanting to get in touch with you, Jennifer, what's the best way for them to be able to find you?
Um, you can Google my clinic, Magic City Physical Therapy, or Jennifer Spencer in Birmingham. I have an Instagram account, Magic City PT, where I try to post at least 5 to 6 times a week helpful pelvic health tips and tricks. So if you're somewhat interested in my talk today, but don't want to make a commitment to see a pelvic health specialist, follow me on Instagram just to gain a little bit more knowledge. Um, but I would say that would be the best way. Yes. And if you're down in South Alabama, uh, contact my clinic. We can help you find somebody down in that region that specializes in pelvic health. There are more and more pelvic health therapists nowadays than there were 10 to 15 years ago. And I know of some highly qualified therapists down there in the Gulf.
Awesome. Well, thank you so much for coming in and spending a little bit of time with us talking about our pelvic health. Many people just don't know what that area significantly means to us in our daily living. So thank you again for coming in and sharing that with us.
You're very welcome. Thank you for having me.
Awesome. All right, guys, we will see you on the next episode. Take care.